Untreated PPD can have substantial adverse effects on the well-being of the mother and child with lasting consequences. PPD with onset in pregnancy is associated with an increased risk for maternal substance abuse, preeclampsia, preterm delivery, and infant low birth weight. PPD can impair a woman's ability to care for herself and infant, negatively impacting child's cognitive, behavioral, and emotional development. The U.S. Preventative Services Task Force recently recommended universal screening for depression in pregnant and postpartum women, based on the finding that programs combine depression screening with adequate support systems in place improve clinical outcomes. Universal screening for pregnant and postpartum women has already been attempted in several states. For example, in 2006, New Jersey became the first state to require postpartum depression screening, but it soon became apparent that it was important to have adequate support systems in place. Healthcare providers should ask pregnant or postpartum women questions about their mental health. There are two main questionnaires. One is called the Patient Health Questionnaire 9, or PHQ-9, and the other questionnaire is the Edinburgh Postnatal Depression Scale, or EPDS. Both the PHQ-9 and EPDS are reliable and valid scales for antepartum depression assessment. The PHQ-9 captures somatic symptoms, while the EPDS detects depressive symptoms comorbid with anxiety during early pregnancy. Studies show that simultaneous administration of both scales and questionnaires may improve identification of antepartum depressive disorders in clinical settings. There are a number of advantages to these changes. The term peripartum recognizes that depression and other mood disorders occur during pregnancy, which is important since there has been an incorrect tradition of believing that pregnancy is protective against mood disorders. The change also recognizes that treatment of mood disorders during and immediately after pregnancy is complicated and risky and deserves special attention. The change is also likely to improve social acceptance of the need for treatment of mood disorders during and after pregnancy.